Bendigo Health has a palliative care liaison nurse who is a contact for referrals to hospice and community palliative care, where patients are assessed individually and the appropriate care planned for them.
We commenced a palliative care liaison nurse through some feedback from patients and families that there was no palliative care input on the acute campus and also the other wards of the subacute campus. So we commenced a palliative care liaison nurse to see these patients, to enable them to have access to palliative care, to provide a single entry point for within the Bendigo Health organisation, and also for these people to have access to palliative care as well as education and support for our other health professionals. So for our patients, it's certainly made an impact to their care. So for some of them it's meant that we've facilitated admission to the hospice prior to going home. For some of them it's meant that we enable them to be able to go home, so linking in the services that they need to go home and supporting them and their family with that. Families and patients welcome that input. So they welcome someone who thinks a little bit differently, about more holistic. These patients may or may not be linked into the community service, so it enables us to link them in if they're not already. But if they are linked in, it allows us to then gather that information from when they're in the community and make sure that gets brought into the hospital setting as well.
The palliative care liaison role is developing rapidly and has grown to see 19 patients a month, ultimately helping more patients and more families in their palliative care journey.
For the hospital, it's certainly decreased some lengths of stay, so it's enabled us to get people out of hospital sooner. It's allowed us to use our hospice beds more appropriately for the patients who are of most need, and it's supported other health professionals to provide care, to make sure that they're thinking about the palliative care aspects of care. But there's also, I guess, more opportunities for us to teach others to enable them to care for them as well, and that's what we're hoping to do in the future.